Hi everybody, this is Bridget from Speech Therapy Talk, and today we're going to be discussing S. So there's a few common errors that a child may have when they say S incorrectly. One common error is a lisp, a frontal lisp. What a frontal lisp is the tongue comes out between the teeth, supper, instead of supper. The S almost sounds like a TH, supper. Now, we don't want to do this. I'm going to now talk about what you should do when you say S. So when we say the S, we want our teeth together, or almost together. They have a very slight gap to allow for airflow. Supper. And the tongue is pulled back, and the tongue tip is either pointing up or down. Don't worry so much about the tongue tip. What I really want you to focus on is getting the teeth together and the tongue behind the teeth. Not touching the teeth, but behind the teeth. Supper. So some great cues for that is to encourage your child to smile. That kind of pulls the tongue back. Encourage the teeth to be almost together and tongue in mouth. You can first, when you're first teaching this, a really good idea is to get in front of a mirror because you can really see it. If your child's having a frontal lisp and the tongue's coming between the teeth, putting them in front of a mirror, showing them what your mouth is doing and what their mouth is doing or should be doing is a really good technique because they can see it and start to feel what their lips and their tongue and their teeth should be doing. Now, another error, not as common, but I do see quite a bit of it, is a lateral lisp. Now, if a child has a lateral lisp, but the air is escaping on the sides, supper. So their teeth are together and their tongue's behind their teeth, but the air is escaping on the side. Now, we need some closure. So when we say S, the sides of the tongue have a seal on the top of our mouth. When a child has a lateral lisp, the air is escaping on the sides. So if this is your child and you think your child has a lateral lisp, I really do recommend getting an evaluation from a speech-language pathologist. They can help figure out what's going on, and you can get a more tailored program of how to help your child. So I really do recommend you going ahead and doing that. In the meantime, you can start practicing. One really good idea is to have your child smile and almost exaggerate the smile. Oh, and I would take your fingers and really pull their sides of their tongue or sides of their lips back. And that kind of helps them get their tongue in the right place. That's a really good place to start if your child has a lateral lisp. And check out the cue section because there's quite a few more cues in there to help you. The other thing is you need to worry about S is the jaw. So if your child's having a lateral lisp, a frontal lisp, or a different error, a lot of times the jaw is not up and centered. They might be saying, it's never going to sound right. So you want to make sure that the jaw is up and center, not to the side or not down. And to teach that is exactly what I just did. I place my hand on the child's top of the head lightly to keep it centered, and then I press up on their chin and let them feel what up and center really looks like. Now, once they get the hang of it, there's some verbal cues. I might say mouth, jaw, jaw up. You know, in the cue section, there's a lot of different ideas there that you can play around with and see which one best fits your child. Well, I hope some of those cues help you. Good luck practicing, and let us know if you have any questions.